Well, the pandemic showed us the desperate need for mental health care across the nation. On October 8th, MetroHealth's new Behavioral Health Hospital will help fill some of the gap here locally.
Senior health correspondent Monica Robbins is giving us an exclusive look tonight inside the center and explains why it is so pivotal to have it here.
It began as a plan to boost the need for mental health care in the region, but things changed in the last 3 years, and it's needed now more than ever.
The original plans for the hospital started in 2019 after a study that showed this region was about 220 beds short of what we needed for behavioral health. So Metro planned this unit to fill about half of that gap. But now, since then, we've had the closure of other units in the community, such as St. Vincent's, and we'll be barely keeping even with the number of beds that the community has.
And with the closure of St. Vincent Charity, there will be a big need for detox beds. So these rooms may help fill that gap for people who have a substance use disorder and a mental health disorder. It provides 112 beds with in- and outpatient care and a new care philosophy that follows the patient from the time they arrive through every aspect of their journey. Hospital stays will be shorter, 7 to 10 days on average, while people are evaluated and stabilized.
We have one unit for mood disorder patients and one for thought. And the plan to separate them allows us to better plan for programming and activities that are appropriate to that population.
Everything designed to keep people safe, secured entry and exit access, furniture weighted with sand so it can't be lifted, door handles, TV sets, shower heads, and safety bars designed to prevent ligature points. Even the screws are specialized so they can't be removed. Maintenance spaces for electrical and plumbing are self-contained to keep worker tools out of the patient's reach. Magnetic bathroom doors provide privacy, but no risk of injury. Subtle safety in a peaceful environment.
I think the colors are just a very calming color. The space is very open, but the photographs and the pictures are basically put on the wall so as not to present anything that could be used to hurt someone.
The spaces are dedicated to patients based on age and need and can treat adolescents, adults, and seniors at the time they need it most.
It also includes an outdoor recreation area, and all of this is based on a new philosophy of care that follows patients through inpatient, partial hospitalization, intensive outpatient, and outpatient services. And patients also have access to community organizations to provide them with the support services that they need as they move through their healthcare journey. And don't forget, everyone, next Friday, we're going to do a half-hour special at 7 o'clock on Metro's entire health transformation. It's more than just physical buildings. Huge. This is about turning healthcare on its ear and kind of reinventing the way we need to keep people healthy and really out of the hospital.
Oh, yeah.
Well, Metro is our county hospital, so
Yes.
I mean, it is like they deal with so many people, and it's such a critical resource.
Yes.
So it's really awesome to have that resource growing.
And yeah, and the technology that is actually growing, and also how it's giving back to the community. But not only that, why everybody in the suburbs needs to pay attention, because this affects all of us.
Mm-hmm.
It's
right.
really an important issue when Metro is about to open in the next couple of weeks, why this is important and why it affects all of us. And it's going to affect your healthcare too, because everyone else is starting to evolve into this new model. And I'll explain it all next Friday at 7.
Can't wait.
Okay.
Transformation.
Looking forward to that.
Thanks, Mon. Sure.
Thank you.